What I do for Thresholds spans a wide variety. Every day it's something different. I supervise a team of 5, and at the same time, all of us are providing outreach and engagement and short-term case management with individuals with major mental illnesses who are also homeless on the CTA trains and buses and their immediate surrounds. The CTA project was a collaboration with the city and my program director, and the CTA themselves noticed a lot of homeless people essentially living on the trains and thought that it was a population that wasn't being served enough by other homeless outreach teams that are part of the mobile assessment unit.
Outreach is very important in getting people the resources that they need and to Thresholds, because we're able to engage people outdoors that perhaps the city isn't able to reach and other entities. And we're the only mobile outreach team that's citywide on the CTA, the library, the shelters, a variety of settings. And so without our initial engagement with the outreach staff, which I used to be an outreach worker myself, a lot of these folks would maybe languish on the streets, they wouldn't get their needs met, and not to over-dramatize, but I think during certain weather conditions, it can be a life and death situation. So we often have the ability to, again, meet people's basic needs and then ultimately engage them. And the goal is hopefully a permanent solution, which might be housing, treatment, other services.
Well, outreach services are really the bread and butter of what we do at Thresholds. Thresholds has had for 50 years a mission of working with people who have the most severe mental illnesses. And when you've got a really severe mental illness, something like schizophrenia or bipolar disorder that's at kind of the extreme end, often it means you end up poor, you often end up disconnected from friends and family and services, you often end up homeless. And so our ability to do outreach to people who have these kinds of severe illnesses, to welcome them and engage with them and invite them into services and help them to get help, is really critical to our ability to do work with that population.
Resources that people will need that they don't have include housing applications. It includes transportation resources like the RTA pass. It could include meeting a psychiatrist to get a psych eval to apply for SSI, food stamps, medical card, maybe information about food pantries, clothing referrals, things of that nature.
I think it's a priority of Thresholds to reach this population so that we can have them take advantage of the other great Threshold services, which include ongoing community support services. We're sort of the introduction or first step, entree, whatever, into Thresholds. And by engaging them and starting to work with them, it could take days, months, and sometimes years. We always want to instill hope that someone's quality of life can improve as they move from the street or the shelter or the trains. So the bottom line is that Thresholds, not to overuse a cliche, has a whole range of open door services, meaning that they can move from meeting their basic needs to possibly psychiatric treatment and then possibly even a job beyond that and stable, secure housing.
Housing is such an important resource for the homeless individuals that we serve because it's at least anecdotally noted that our folks are doing much better when they're inside than when they're on the street, and naturally because they're not victims of crime, they're not having to sleep in a public place, they're not getting picked up by the police. Also, the Housing First model is pretty recognized as an evidence-based practice, and we have 2 safe havens, which are low-demand housing. So we have the option of housing someone immediately, and it can also be an incredible engagement tool. If someone's been out there for a while and you're offering them somewhere to lay their head for the night, it's incredible.
If the individuals that I've seen that have housing, the recovery process for them would look like having, focus on their health, their psychiatric needs. I've seen individuals, reconnect with family or friends or establish some support for them in their recovery process. I've seen individuals, some go back to school, some find employment. It varies from person to person. It's just staying off the street and being safe and secure.
The specific services that go into doing outreach with somebody are really individualized. It depends a lot on what the person needs. But it means that our staff have to be out on the street where people are. So our staff will spend time riding the CTA and cruising the Harold Washington Library and visiting homeless shelters and visiting people in the homes of family members and being in abandoned warehouses sometimes. They need to go wherever people are and then try to find out from that person's perspective what it is that would make their life better, what it is that they want and need from us, and to use that as an opportunity to engage with the person. Sometimes people need help with a place to live. Sometimes they need help with food. Sometimes they're struggling with, minor problems with the law, a misdemeanor for trespassing or something like that. Whatever they need is something that we'll help them with, and helping them with it also forms a bridge into helping them with other things. If we can do some things for them that make a difference in their lives and that make their lives better, even in small ways, and it's very individualized, then we have a basis for helping them with some of the bigger things.
Outreach is so important, and it's vital to Thresholds because we are going outside to where our members are, our clients, and we're going to the places where they are in terms of they could be at the library, they could be at the shelter, they could be on a corner of a street. We're reaching them instead of waiting for them to knock the door of an office. We're going to where they may consider their homes are and finding them and providing them services in a way where it's just to try to eliminate the stigma of going into a social service agency. We're engaging them as, it's just such a passion of mine, I get emotional. We reach them to where they are. We don't wait for them to come to us. And I think that's so important because not everyone knows where to go, and not everyone, is, even if you're homeless, you have pride. You don't want to be put in a place where you're stigmatized or you could be rejected. Someone's coming to you to help you.